Thank you, sir.
Next is Asada Sandhigata Roga Vijnaniyam Adhyayam Vyakhyasyaamah Yathovacha Bhagavantanandri, the diseases of the Sandhi. And the diseases of the Sandhi are Puyalasaha, Sa Upanaha, Sravaha, Parvadika, Allergy, Krimi-Granthisha Vijnayaha Rogaha, Sandhigataha Nama. The 9 disorders of the Sandhi are Puyalasa, Upanaha, Srava. There are again depending upon the doshas, Bhataja, Pittaja, Kapaja, and Parvadika, allergy, krimi granthi. These are the diseases of the sandhi, or the corners, like or apanga and karina. That's the area. And anatomy of the sandhi we have already discussed about that. Now the puyala says pakvaha shofa sandhija samsravebhyah sandram puyam puti puyalasa saha. The suppurative swelling which presents with the thick discharge, purulent discharge, which is present in the angle of the eye, usually the medial angle of the eye, or it could be in the lateral angle. So, which is that's called as the puyarasa. And that kind of a situation is exactly what we see in the dacryocystitis. Dacryocystitis is one of the very common condition where the lacrimal gland duct system is affected. The normal lacrimal duct system, lacrimal secretion system is, of course, basic physiology of the lacrimal secretion is to facilitate the functions of the conjunctiva, keep the conjunctiva healthy, either by simply the moisture, physical moisture, as well as it also can have a washout effect, like if there is some particles reaching to the conjunctiva, that can be expelled out. And it also has a protective function, and there is a continuous circulation. The lacrimal secretion is from the lacrimal gland, which is on the lateral part of the eyelid, on the superior eyelid, and then the same is collected over here in the medial aspect by the lacrimal ducts as such, which is pointed out at the lacrimal punctum. Again, two of them are there, superior and inferior lateral punctum openings, through which it flows through the lacrimal canal and then gets collected in the lacrimal sac. And there is a nasolacrimal duct where excess of the fluid will be discharged into the nose, and often it can be expelled out in the form of the nasal discharge. So what happens is normal circulation, there is a continuous circulation which keeps the conjunctiva clean and soft as such, rather moist as such. Now, one of the common pathology there is if there is an obstruction to the lacrimal duct anywhere, it could be, or a simple infective pathology can produce a acute inflammation and that would be what called as the lacrimal cyst, where dacryocystitis, where the patient would have a painful swelling and more discharges from the eyes, as the secretion is blocked there into the lacrimal sac, or nasolacrimal duct gets blocked. The secretions will be from the conjunctival surface only, palpebral surface only, and the patient would have a teary eye as such. Acute again, it can be presented as two forms, acute or chronic. Acute dacryocystitis is presented with the sudden onset of pain, erythema, edema overlaying the lacrimal sac region. Whereas conjunctival injection and these preseptal cellulitis often occurs in conjunction with the acute dacryocystitis. Like there will be local cellulitis also occasionally. Whereas tearing is the most common presentation of chronic dacryocystitis and is related to the obstruction. So chronic is always due to the obstruction, either accompanied with the infective pathology or without infective pathology. And the major complications can occur as cellulitis, or the visual acuity could be reduced, or it also can be a cause for periorbital edema. That's about the dacryocystitis, the puyalasa. Then the next of the condition is grantihi na alpo dristisandau apakaha kandu prayaho nirjastu upanaha. A non-inflammatory swelling, apakaha, non-inflammatory swelling, which is present in the same palpebral area and which doesn't suppurate and often present with itching and painless. It's also painless. That's considered as the upanaha. Now, lacrimal cysts are again common conditions where there is a primarily obstruction, but infection is not present. A non-infective primary obstruction can present as a lacrimal cyst, as you see over here. Usually, it's in the medial aspect of the eye, medial angle of the eye, where the cysts are formed. Or rarely there could be a tumor pathology also. Lacrimal tumors also can occur. The difference between a cyst and the tumor would be cyst would be soft, tumor would be somewhat harder, and the consistency, appearance also. In a typical cyst, you will have that transparent fluid containing appearance, whereas the tumors are relatively firm. The differentiation ultimately has to be based upon the histological findings. The factors which trigger this obstruction without inflammation are like sarcoidosis, autoimmune disorders, rheumatic pathologies also can result in the same. Approximately 50% of the tumors are benign, whereas 50% could be malignant. Majority of the conditions what we see is mainly the cysts than really the tumors. As far as the clinical presentation is concerned, about more than 40% of the patients would be asymptomatic. You will be able to see that swelling only when you extend or stretch the palpebrae, or occasionally a swelling could be seen which is innocuous, doesn't produce any symptom. When the size is quite big, it can produce proptosis. That's proptosis is a inability to close the eyes. The eyelids remain stretched as such, or there could be even vision abnormality, diplopia, because of this asymmetrical movement of the eyeballs, and there could be a mass lesion which can extend in even beyond, and then the whole eyelids may become inward, infiltrated in case of the tumor pathology. These are the major complications. Of course, the primary treatment is surgery. Of course, treatment part we will discuss when we discuss the chikitsa. Then the srava, ashusrava, or the sravas, according to Sushura, gatva sandhin ashmargena doshaha kurihu sravan bhugvihinan kaninant tan vai sravan netranadi mathike tasyah lingam kirteshe chaturtha. The srava or netranadi, they are the synonyms, and the classical presentation would be there will be involvement of the ashrumarga, the lacrimal duct system is involved with the doshas, and there could be discharges, purulent or non-purulent discharges could occur. Based upon the appearance of these discharges, Sushruta has categorized them as Vataja, Pittaja, Kaphaja, and so on. The whole drainage or the circulation of the tears or lacrimal secretions is clearly described by Sushruta as Ashrusravaha siraha gatva netra sannishutishthati tadat kaninakam gatva cha ashruktratva kaninake tadat sravati athasravam yatha dosham vedanam. The secretion is clearly described, that circulation is clearly described, like the granthis are producing the secretions, and this goes towards the kaninaka. Kaninaka is the middle aspect of the eye, and there it gets drained out. So that's the important issue. Then the clinical presentation would be Pakaha Sandho Sansrvedhya Puyam Puya Sravo Rekarupa Pradishtaha Shvetam Sandram Pithilam Sansrvedhya Shleshma Sravo Nirojas Sapradishtaha Raktasravaha Shunitutha Saraktam Ushnam Nalyam Sansrved Natisandram Pita Bhasam Neelam Ushnam Jalabham Pitta Srava Sansrved Sandhimadhyata. Primarily there are two types of the Sravas, Kaphaja and Pittaja. Kaphaja Srava would have whitish, thick, slimy discharge, which is painless, whereas Pittaja will be presenting with all the signs of inflammation, where there would be pain and burning sensation. Discharges could be reddish or maybe warm as such, or a neelam, or it could be bluish, reddish, or so on. Different colors, purulent colors could be seen, or jalabham, simply serous discharges also can occur in case of the pittaja. So the the basic issue, such secretions are always produced with obstruction. Dacryocystitis with obstruction is again a common phenomenon, And of course, the current protocol of the treatment would be the dacrys cystitis can be easily managed either with the syringing so that the channel is just washed out, or it could be by probing. The whole system is a very delicate system, very fine system. Dimensions of the system are the the proximal portion of the inferior lacrimal duct would be around 2 millimeter, whereas the ascending portion, the ascending branch is around 8 millimeter, and the lacrimal sac is around 10 millimeters, and the duct, the nasal duct, which ultimately secretes, is around 12 in almost in an adult condition. Now, others, the obstructions could occur anywhere, and often the obstructions are due to some debris, solid substance occurring in some area, and hence it can be easily washed up. So, majority of the conditions, the approach is simple: make it easily washed up with either syringing or maybe probing. For probing, these dimensions are important. The other structures, the other components are the ampulla. Again, same thing which we have just discussed in the earlier slide also. The anatomy of the lacrimal drainage system. The issue that anatomy knowledge is quite important if you handle that. So, secretions nature, from the current point of view, it may be thick or it may be thin or it may be presented as purulent, whereas Sushil has categorized them as a kaphaja or pittaja based upon the secretions. Now, you may have plenty of patients who present with the different sorts of the secretions in the eyes. What does it mean? Now, from the current point of view, if it is a yellow mucus conditions, it could be a consequence of the stain. And white or yellow balls of mucus, thick, could be signs of dacrocystitis, or thick crusty mucus may be caused by blepharitis. Now, thick crusty is a usual sign of kapha, and the stingy white mucus, it could be again presented with the allergic conjunctivitis, or watery mucus, it could be presented again with viral conjunctivitis. Small dry particles of the mucus is often a consequence of dry eye syndrome. These are the common conditions. Again, there could be plenty of other conditions where there could be secretions. The common conditions where the patient may present primarily the secretions from the eye or discharges from the eye as a presenting symptom as such. Anyway, that's about the Sravas. Then the next is the Parvani. Tamra, Tanmi, Dahashulopavana, Raktadnaya, Parvani, Vrittashopa. Parvani is a patient presenting with a swelling or an ulcerative appearance or swelling which is reddish in color and superficial. Tanmi is superficial and presents with the pain and burning sensation, and it's produced due to rakta. It presents as a vrittashopa, a circular swelling. Now, this is often seen in case of the ulcerative keratitis, chronic ulcers over the sclera, which also can affect the cornea. And often the causes of them could be immune reactions like tuberculosis, leprosy, rheumatoid pathology, Sjogren's syndrome, etc. There will be deposition of the keratin tissue over the sclera, and you will see superficial ulcerations, and or it also could occur due to the infections with the bacteria or chemical irritation. Now, in these conditions, either there could be pain and discharge as a clinical presentation, or when it affects or when it covers the sclera, it may even produce an opacity. And a most common condition for the blindness in India is the ulcerative keratitis, where the patient may have an ulcer which could be any of these causes, and that corneal transplant, the common eye donation and corneal transplant which is done, is the best cure there, and that is a most successful part of the treatment in such conditions. And in the present days, this national health program, that ulcerative conditions are given maximum stress upon that, and that movement for the eye donation and the transplantation of the cornea, these are given lots of push from the national health program to avoid the blindness. That blindness eradication program, the major portion is on that part as such. Now, another of the similar situation where the ulcers could occur and the ulcers are presented in the Krishna Shukla area. Jata Sandhu Krishna Shukla allergy syad tasmin eva khyapta purvalinge. Otherwise, they are the similar conditions, ulcerative conditions, as in case of the Purvani. But when it occurs in the central area, that's exactly at the cornea, the middle of the cornea, and necessarily that produces the blindness, because it prevents, it becomes opaque, the sclera becomes opaque, and hence that produces the blindness, which we call as, we categorize as central ulcers. Otherwise, they are the same. Ulcers are same depending upon the location. Peripheral ulcers, they may not produce the blindness immediately, whereas central ulcers, they produce a blindness. But other symptoms are common, like discharges and irritation are common. And as I told you, that whole program of the eye transplantation, this sclera transplantation is the same issue. Then comes the Krimi Grandhi, Vartmanah Pakshmanascha Kandum Kuri Krimea Sandhijataha, Nana Rupa Vartma Shuklas Sandho, Charanto Antarnayanam Dushayanti. Now, Krimi Grandhi is produced due to the production of inflective pathology involving the palpebrae. Of course, in the blepharitis, or that inflammation of the palpebrae, also are discussed in the vartmagata vyadhi and in the sandhigata vyadhi. Now, sandhigata is when the lesions are more in the angles of the eyes. When it's generalized, it could be a vartmagata vyadhi. So, we will be discussing the same issue, blepharitis, in the next condition 2, next chapter 2. And it presents with Vartmanah Pakshmanascha Kandum, that it presents with the itching of the eye brows as well as the palpebrae, eyelids as such, and it produces the irritation of the eyes, and it can produce a conjunctival irritation as such. Now, blepharitis is an inflammatory condition which involves multiple causes, and it's not a single condition. It could be produced due to bacteria, fungal or viral infections. It could be produced due to the obstruction to the glands, and it could be produced due to the allergic reactions. It could be triggered due to the hormonal changes in the body. Stress also could be the triggering factor for the blepharitis. Of course, we will be discussing about the blepharitis in different names as per Trishula in the later Vartmagata Vyadhi also. So, when it is presented, the symptoms are more presented in the angle of the eye. That could be considered Sandhigata Vyadhi, and that could be Vartma Grandhi. And the clinical presentations are common. Red lids, the inflammation could be reddish there, as you see the lids could be reddish, or the eyes, conjunctiva could be reddish due to the irritation of the conjunctiva. Patient may have photophobia, pain, the vision could be decreased, visual fluctuations also could occur. With this, the Sandhigata Vyadhi are completed. Next is about the Vartmagata Vyadhi. I think we will continue in the next session. Today, of course, we finished a bit early, fine, because chapter is shorter. Right, okay, our Sandhigata Vyadhi, that chapter is a bit bigger. Okay, we will take up the Sandhigata Vyadhi also, some of the diseases today, and then maybe we will reserve the portion for the next condition. Vartmagata Vyadhi. So, next is about the Vartmagata Vyadhi. Now, among the Vartmagata, Athata, Vartmagata Roga Vijnaniyam Adhyayam Vyakhyasya Mahitovacha Bhagantanundahi. The Vartmagata Vyadhi are the Pratak Doshaha Samastava Yada Vartma Vyapashayaha Sira Vyapya Avatishtante Vartmasu Adhikam Uchitaha Vivardhya Mamsam Raktam Chatla Vartma Vyapashayata Vikaran Janentyasho Namatasthani Bodhata. The vikaras, diseases which are produced in the Vartma or the palpebrae, eyelids, due to the vitiation of the doshas and involvement of the siras, the vascular structure there, and they grow, and it may even involve the mamsa and the rakta, that's the soft tissues of the eyelids, and such conditions are called as Vartmagata Vyadhi, and they are, name of them are Utsangini, Atha Kumbhika, Pothakyo, Vartma Sharkara, Tata Arsho Vartma, Shushkasha, Tathaiva Anjana Namika, Bahalam Vartma or Vartma Bahala, Yachapi Vyadhi Vartma Avabandakaha, Krista Kardama Vartmakyo, Krista Vartma and Kardama Vartma, these are again two different issues. Shava Vartma Tathaivacha, Praklinam, Apariklinam Vartma, Vatahatam Teta, अर्बुदं निमिषश्चापि शोणितार्षस्य यत्स्मृतं लगनो विशनामा च पक्ष्मकोपस्तु चैव च एकविंशतिरित्येते विकाराः वर्त्मसंशयाः नामभिस्ते समुद्दिष्टाः 21 varieties of the vartmagata vyadhi are mentioned. Among them, the first is आभ्यन्तरमुखी बाह्य उत्संगो अधो वर्त्मनस्या विज्ञेया उत्संगिनी नाम तद्रूप पिडकाचिता. Utsanginī is a localized swelling in the eyelid which may have an opening towards the interior, that's the posterior surface, or towards the anterior surface, either bahya or abhyantaramukhi. Such is considered as a Utsangini. In the present day situation, we name such condition as chalasia, chalasia singular, chalasia plural, and it's all produced due to inflammation and obstruction of the sebaceous glands of the eyelids, and this has to be differentiated from the stye. Stye is an acute inflammatory pathology and infective pathology, whereas chalasia is a non-inflammatory obstructive pathology, and it presents with a painless swelling, nodular swelling, where there would be no color changes seen on the surface as you see over the eyelids, and only on palpation you can make out that. Occasionally it may result in acute inflammation and lead to pus discharge. Most of the times during the course it remains asymptomatic, except that palpable or the visible swelling. It doesn't produce the symptoms. When the conjunctiva is stretched, you may see the surface as slightly reddish, again doesn't produce much irritation. But when it becomes inflamed accidentally, then it produces irritation of the eye, or occasionally it may burst open and may produce a sinus, persistent sinus over there, which requires the treatment. So that's the Utsangini as such. Then कुंभीक बीज प्रतिमाः पिडका यास्तु वर्त्मजाः अद्भुतयन्ति भिन्नायाः कुंभीक पिडकास्ताः. Kumbhika Pidaka is a situation where there could be initially multiple eruptions over the area, and they generally do not produce pain when they are burst open. Maybe they could produce a distension or a swelling over the area, and because of a hardness, they are felt as hard like a seed of kumbhika. That seed of a harder seed like a palpation is seen. Now this kind of a situation is often seen due to the calcification of the skin. So calcinosis cutis is a condition where the skin is calcified. It can occur anywhere. See, calcification can occur, calcification can occur anywhere. But when it occurs in the eyelids, it's more commonly visible, like it's directly visible, and often produces that visible cosmetic deformity. So people would be more worried about that than really a calcinosis elsewhere. And characteristically it's presented as a painless, hard nodular swelling. Moderate sized calcinosis lesions, they do not produce any symptoms except for the cosmetic reasons. But if it becomes bigger, it may affect the palpebral movement. The movement of the palpebral eyelids may be affected, and hence it can produce a conjunctival irritation. So that's the Kumbhika Pidaka. Then the Savinya Kandura Gurvyo Rakta Sarshapa Sandibhaha Pidakash Charjavatya Pothakya iti samjitaha. Pothaki is another of the condition where there would be multiple swellings which are reddish in color and small sized swellings, and hard also, which are present on the internal surface or the posterior surface of the eyelid, and hence produce the pain. They are considered as pothaki. Now in the present day situation, we call that condition as a trachoma. Trachoma is one of the major issues related to the eye now, and it's one of the highest having incidence of the cause of the blindness throughout the world, and it's due to inflammation produced due to a specific bacteria, and the identified bacteria is a chlamydia group. Chlamydia trachomatis is the type as such. Clinical presentation could be of two forms, like active phase or cicatrizing phase. Active phase mostly asymptomatic. There would be not many significant symptoms, but gradually it's a very chronic condition. The palpebral surface, if you stretch the palpebral surface, you can see multiple irregular swellings, roughness. The whole area becomes rough. As a result of that roughness, it can result in irritation of the conjunctiva, That's one of the issue. And continuous irritation of the conjunctiva also can produce a scar formation and the vision could be affected. The same corneal ulcers could occur. Or it also can result in the hairs of the eyelids, like the eyebrows, either getting bent, producing the irritation to the eyelids, or they may fall off and they may fall into the eyelids and then produce this. This can be the later consequences are quite troublesome. Trachoma in that condition, it could be quite troublesome. Or trachoma also can result in a dry eye situation. Now, dry eye is a situation where the tear secretion is not proper and hence there would be irritation of the conjunctiva. The patient would have irritation of the conjunctiva, and these are the major clinical symptoms. Gradually it can result in corneal opacity and the blindness, and trachoma is one of the quite common disease which we see in the clinical practice. Now, trachoma also can present in the form of a thicker granular presentations, bigger granular presentations, and in that condition, Sushruta had called them as a vartmagata. Pitakabihi, susukshmabihi, ghanabihi, abhisamurta, pitakaya, khara, sthula, sadnyaya, vartmagata. Vartmagata is, from the current point of view, it's a trachoma only. Trachoma can present with that acute phase where there will be initially only fine granuloma, later chronic phase where there could be cicatrization, fibrosis, and that when it is cicatrized and granular, it is called as a vartmagata by Sushruta. So it's the same condition as such. Now, because it's a very common condition as such, WHO has given a grading scheme for assessment of the trachoma, and that grading scheme is of course normal eyelid, then trachematous inflammation, the initial stages, and the trachematous inflammation with the mild granulation, and trachematous scarring is another grading, and trachematous trichiasis where the hairs would be curved and then it becomes corneal opacity. So these are the grades given by guided by the WHO assessment program, and that's exactly what we call as Pothaki and Vartmagata. Pothaki in the initial stages, Vartmagata in the later stages. So now you give it as a grading and then give a grading number like TS, TI, so on. Whereas Sushruta had graded this as a Pothaki and Vartmagata. So exactly the same issue. There is nothing new in that grading. Whatever Sushruta has mentioned is really the grading as such. Then comes the condition of Yervar Bija Pratimaha, Pidakaha Mandabedanaha, Sukshma, Khrash Vartmastaha, Tal Arsho Vartma Kirtide. Arsho Vartma, the word meaning of Arshas is anything which is having a projection like, and when it occurs in the eyelids, that's called as Arsho Vartma. And you see such conditions mainly in the epidermal cysts, inclusion cysts. Epidermal inclusion cysts are a sort of metaplastic conditions where the epidermal tissue grows deeper in and then forms a cyst as such. It's an epidermoid cyst due to proliferation of the epidermal cells within the circumscape of the epidermis. And often it presents with a typical roundish, smooth surface with swelling, which is painless, either on the external surface of the palpebrae or occasionally on the internal surface of the palpebrae. Most of the times it is asymptomatic, doesn't produce any symptom. And when it is open, you will find either thick secretions, occasionally harder nodular seed-like appearances also could be seen in such conditions. That's exactly Yervar Bija Pratimaha. Yervar is a monocotyledon plant-like, and that kind of seeds, hardened nodules could be seen. A microscopic histopathological appearance of epidermal inclusion cyst can show you that. Very rarely, some teratomas also can occur in a similar fashion, where there could be some other harder tissues like bony, something resembling bones or hairs also could be seen in the dermoid cyst. So either it could be a epidermoid or a dermoid cyst where the different sorts of the tissues could be presented, and it's also common, and very often it's a congenital pathology which is asymptomatic only when the size becomes bigger due to its mechanical size, or when it involves the conjunctival surface. Because of the irritation, it produces the symptoms as such. Then the another of the condition is a Shushkarsha. Shushkarsha is a Dirgho Ankura Khara Stabdho Dharno Vartma Sambhavaha Vyadhi Samakhyataha Shushkarsha is Samnitaha. Shushkarsha is where there will be elongated swelling which is having a rough surface and firm in consistency, Dharana, firm in consistency. Such is considered as a Shushkarsha. The papillomas. Now, papillomas can occur anywhere in the body, anywhere in the skin, papilloma can occur. And when it also can occur in the eyelids. When it occurs in the eyelids, that's called as a Shushkarsha. So, Sushruta has mentioned Charma Arsha, where the arshas could occur over the surface of the body anywhere. That's a typical papilloma. And when it occurs in the eyelid, it's the Shushkarsha as such. And though it's not very rare, you may see many of the patients like with these symptoms. Of course, the symptoms are only due to the mechanical factors, like when it is located very close to the edge of the palpebra, it may affect the vision. The patient may feel like there is something object to feel in the visual field, and hence the patient may be disturbed. Or if it is like size is bigger, it may produce a mechanical irritation there. Otherwise, many times it can remain asymptomatic. So that's about the papillomas. Then comes the Dahatodavati Tamra Pilaka Vartma Sambhava Mridvi Mandaruja Sukshma Jinyasa Anjana Namika. Anjana Namika is a condition where there could be a single or multiple swellings in the Vartma, in the eye palpebrae, which is soft, painful, and sukshma, fine as such. That's exactly what you see in case of the blepharitis. Blepharitis, we have already referred to in the sandhikata vyadhi also. Same, it produces the inflammation, and the blepharitis can present with various sorts of representation as a generalized one, or it could be localized when there could be localized conditions, and it also could be often associated with the seborrheic dermatitis, rosacea, systemic conditions, or it also can be affecting the chalazion or conjunctivitis, etc. Depending upon its location, it also can be classified as a anterior or posterior. Anterior is when you see the inflammation more on the anterior surface. Posterior is when the inflammation is seen on the conjunctival surface. That signs of irritation to the eyes and then visual irritation or infiltration into the sclera, they are more common in the posterior. So, in such a condition, when the inflammation is relatively widespread, that's called as a anjananamika. When it is localized and over the medial angle of the eye, that comes under the sandhikata vyadhi. Now, then bahala vartma is another of the condition where vartma upachiyate yasya pidakabhi samantatah savarnabhi samabhischa vidyat bahala vartma, a situation where there are multiple swellings which are having the same color as that of the skin, that's non-inflammatory multiple swellings, which have a smooth surface, they are considered as a bahalavartma. Bahalavartma you can again see in the epidermal inclusion bodies, which also is called as milia. Milia again can occur anywhere in the body, usually asymptomatic, often occurs in children, and it is presented as a yellowish doomed lesions which are small, like 1 to 2 millimeter, and can present in anywhere in the body. Multiple can occur, and occasionally when they are clubbed together, it may produce a erythematous plaque-like appearance. So again, asymptomatic, most of the conditions, it is a situations, it is self-limiting, doesn't require any specific treatment, and often is seen in children as such. Then the Kandumata Alpatodena, Vartmashopena Yonaraha, Nasamam Chale Dakshi, Bhaved Bandha Savartmana, Vartma Bandha or Vartma Avabandha is a condition again where social says there will be itching as the most presentation, comparatively painless, and swelling of the eyebrows as such. Now, from the current point of view, it is also a variation of the blepharitis, particularly when the allergic phenomena is so common. Most of the times it occurs due to cosmetics applied over the eyes, and the patient may have that typical allergic manifestation, erythematous swellings in the eyes, either limited to the external surface, anterior surface, or occasionally it may involve the conjunctival surface too. And this is another of the common condition which is considered as a Vartma Bandha as a by Sushruta. Then Mrudu Alpavedanam Tambram Yadvartma Samamemacha Akasmat Bhavet Raktam Krishta Vartma Taladisha. A Krishta Vartma is a situation where the patient may have a relatively soft, painless swelling along the palpebrae, along the eyelids, and the eyelids otherwise they may maintain their shape except that bulging, and occasionally occurs and often may not be related directly to the eyes. That's called as Klistavartma Besushra. Now, in the present situation, one of the common clinical signs in many diseases is the periorbital edema. The periorbital structures are such that there is a very soft tissue, fat tissue is a loose areolar tissue around the orbits, and it is covered by a bony socket, and hence whenever there is an edema, fluid is collected, that fluid is always producing a bulging around the eyelids, over, whereas the surrounding socket is bony and hence that cannot bulge. So any of those conditions where there would be some abnormality of the fluid exchange in the tissues can present with the periorbital edema, and periorbital edema is a common clinical sign in many renal diseases, can be anemia or thyroid diseases. Simple loss of sleep also can produce a periorbital edema. So patients presenting with the periorbital edema, you need to give attention to the systemic factors, and then the management has to be on that line, and such condition is named as Klistavartma Besushra. Then Klistam Punah Pittavitam Vidahet Shonitam Yada Tada Klinatum Apanam Muchate Vartmakarmaha. When otherwise similar appearance, but when it involves the conjunctival surface and produces lot of discharge, that condition is called as a Vartmakardam. Now this is exactly what you see in case of the blepharitis with conjunctivitis. The blepharitis, the same issue which we have discussed already, and when the involvement of the conjunctival surface results in the conjunctivitis, inflammation of the conjunctiva and a lot of discharges, the whole appearance that persists and discharges over there, that makes the clinatum, it's moist as such, and Sushila has considered this as a Vartma Kardamaha. That it's from the current point of view, this also is a variant of the blepharitis. Then Yadvartma Bhashyato Antashta Shavam Shunam Savedanam Daha Kandu Parikleti Shava Vartmeti Tanmatam. When a similar condition which produces a bluish discoloration and swelling with the pain and the itching also comes as a Shava. Now this also is a variation of the blepharitis. In many of the blepharitis conditions, when there is a vascular stasis, that presents with the same issue. Then Klinavartma is another of the condition mentioned by Sushila. Arujam Bhashita Shunam Anta Klinam Sarvatyapi. Kandu Nistoda Bhuvistam Klinavartma Taduchate. Klinavartma is a condition where it is painless and there is a swelling both on the inner surface as well as the outer surface. Even there could be slight discharges, and mainly it is the itching and nistoda, heaviness as a symptom. Now this is very common in case of the angioneuritic edema. Patients who have systemic allergic manifestation, there could be edema of any other part of the body. Angioneuritic edema often manifests very prominently in the eyelids because of the same issue which I discussed earlier. The eyelids tissue is loose areolar tissue, so any changes in the fluid changes that fluid exchange can be visualized more prominently over the area, though the phenomena is generalized. And in case of the angioneuritic edema of the eyelids, allergic manifestation, this is a very common phenomena. Often in a patient you may see that kind of a swelling in the lips or elsewhere too. So that differentiation has to be made out, and there will be usually a history of allergens contact with the allergens as such. Then the Yasya Dhautani Sambadhyante Punah Vartmani Aparipakvani Vidya Aklina Vartmayata. In a situation where there is an addition between the palpebrae and the conjunctival surface, that's where Sushil says, even if you stretch dhautani, if you wash and wash repeatedly, still there is a union of the eyelids. Eyelids tend to merge together, or eyelids and the conjunctiva tend to merge together. And there will be not much of a discharge, aparipakvani, where there is not much of a discharge. That's called as aklina vartma. And that aklina vartma is exactly the symblepharon. Symblepharon is produced due to additions between the palpebral conjunctiva and the conjunctival surface, scleral surface. And these additions can produce the same issue, like there could be inability to open the eyelids, or the shape of the eyelids also can be varying due to that contractures, additions occurring. And it's a quite troublesome condition, though it's rare, it's not a very common condition. It can produce as a consequence of many inflammatory pathologies, often a chronic blepharitis. primarily blepharitis produced due to chemical irritation often ends up with this kind of situation where the vision could be seriously affected. Vision could be affected due to two reasons. One, these scars may produce a corneal opacity, or the vision also could be affected due to inappropriate movement of the eyeballs. Eyeballs may not be able to move as such. Now, the next is about वातहत वर्त्म विमुक्त संधि निश्चेषम वर्त्म यस्य न मील्यते यत् वातहतम विद्यात् सरुजम यदि वा अरुजम a inability to open the eyelids and due to any of the other factors, that's called as a vatahata vartma. In the present day situation, we name that condition as a the ptosis. Ptosis can be produced due to many factors. Either there could be congenital or acquired. Among the acquired, mainly neurogenic due to the injury to the nerves, or myogenic due to the muscles, or eponeurotic or mechanical or trauma. The most important clinical conditions are myasthenia gravis, where it is myogenic, where the major clinical symptom, the primary clinical symptoms of myasthenia gravis is the inability to open the eyelids properly, and when the patient attempts to open the eyelids, the whole skin of the face would be stretched. The patient has to put more effort, and on stretching you can see the eyeballs also are moving up. Or it also can occur due to the injury to the nerves, palsies, different sorts of palsies, again which we have discussed in the neurological conditions. And in that condition, patient would not be able to open the eyelids at all, and the eyelids remain closed. Or there could be congenital, where the size of the eyeball seems to be altered. So that's how the ptosis is presented, and the management and approach to the treatment would be depending upon the causes as such. Then comes the अर्बुद वर्त्मान्तरस्थं विषं ग्रन्थिभूतम् अवेदनं विज्ञेयम् अर्बुदं पुंसां सरक्तम् अवलम्बितम्. Now, a hemorrhaginous discharge containing swelling which is relatively firm and localized swelling, that's called as vartmarbuda. Among the commonest tumors present around the eyelids is the basal cell carcinoma, or the other way name also is the rodent ulcer, which is quite common, which is presented as indurated small ulcers with a small opening, but the extension is deeper, and basal cell carcinomas are located at the signs or lines of fusion of epithelium and eyelids, and particularly the lateral angle of the eye is one of the areas, and that can occur. Or another common tumor in the eyelids is the melanomas, dark pigmented areas. Of course, from Indian point of view, basal carcinoma is more common. Melanoma is comparatively less common in Indians. But in the non-pigmented races, Western countries, melanoma is more common as such. Then comes the nimeshani. Nimeshani hi siravayu pravishya vartan samshayaha chalayatyati vartmani nimeshasya gadonagaha. Twitching of the eyelids, involuntary movements of the eyelids can occur, or it's also called as ocular myokymia. It can produce due to multiple causes, simply due to the overstrain. If you focus on with the eye for a long duration, it can result in a twitching. Often many of you might have experienced it. Or it also can produce due to the stress or loss of sleep, etc. Very simple causes can produce the twitching of the eyes, and that's called as a nimeshaha. Then apakha katina sthulo grandhi vartmabho arujah sakandohu pichila kola pramano lagana susaha. Lagana is a non-suppurative localized swelling in the eyelids, which presents with the itching or often slimy discharges and or harder consistency, kola pramana or pichila. Either the consistency of the contents would be thin, thick or harder. It can vary. And we will have a large number of such conditions present as the cystic lesions of the eyelids. The commonest forms of the conditions where you will have the cystic lesions are meibomian cyst. Meibomian cyst is actually the meibomian gland which can present with the swelling. Meibomian gland is the gland which secretes this mucin in the eyelids as such. And cysts of GVCs, these glands also are presented in the area where there could be thicker mucinous secretions, harder, which looks very opaque and whitish, and many times it may become calcified also. Or xanthalasma, where the fatty tissue is deposited over there. These are the common conditions which can present with a cystic appearance in the eyelids, and all of them could be considered as lagana. Then शूनं यद्वर्त्म बहुभिः सूक्ष्मैः छिद्रैः समन्वितं बिसम् अन्तर्जलम् इव बिसवर्त्मेति तन्मतम्. A bisa is a condition where there will be a baggy swelling which looks like a bag containing water. Antarjalam bisamiva, like a bag-like swelling around the eyelids, which may even present with the sukshma chidrehi. Thin openings could be, fine openings could be there, and the discharges could occur. This is often produced due to the lymphedema around the eye, and it's also named as Marbihan syndrome. Marbihan syndrome is characteristically by the erythematous edema around the eyelids, which may involve the forehead, glabella, eyelids, and cheeks, and hence the appearance of the face itself is considered as either inflammatory pathology, or it also can occur due to the stasis of the lymphedema also can present that condition appearance as such. Then doshaः पक्ष्माशयगताः तीक्ष्णाग्राणि च निवर्तयन्ति पक्ष्माणि तैर्घृष्टं चाक्षिल्यते उद्धृतैः शान्तिः पक्ष्मविश्य उपजायते वात आतप अनलद्वेषी पक्ष्मकोपः स उच्यते. The Pakshmakopa is a situation where the eyebrows produce the irritation of the eyelids, and this can occur due to the inner conversion or introversion of the eyelids or extroversion of the eyelids due to maybe the changes in the shape of the eyelids, and these are categorized as either entropion or ectropion. Ectropion where it is restricted outside, entropion is the other way, and as a result of that the eyebrows, they produce irritation to the eyeball, the conjunctiva, and it's quite troublesome. And of course the primary treatment there will be, you have to prune these eyebrows so that there will be no more hairs. If the eyebrows are removed, then the patient would have no symptom at all. And continuous irritation, that can produce a photophobia, and that photophobia mentioned by Susali is Vata Atapa Analadveshi. It's not only the photophobia, the patient may have a phobia for a breeze also, sunlight also, or even these anala, fires like bright objects. With this we conclude the vartmagata vyadhi, vartmagata roga vijnaniya nama tritiyodhyaya. So we cover 2 chapters today. If there are any questions, I think I try to answer there, and then right, there are no questions, so we will wind up today.